And this stat always blows me away. Last year alone, there were 10 trillion text messages sent.
Jeez.
98% are read in less than 2 minutes.
Okay.
Yet less than 20% of emails are opened.
Yep.
And less than 14% of phone calls are picked up without being put on hold or shuffled around a call center.
Welcome to Self-Funded with Spencer, sponsored by Pareto Health, ClaimDoc, and PlanSight. Whether we're discussing innovative new healthcare strategies, exposing hidden revenue streams or misaligned incentives, or even just cheering on the next generation of this industry, we promise you that you're going to learn something. So thank you for joining us for another great conversation about the future of healthcare. So I'm here with Dave Mallen of HealthJoy, man. What's going on?
Not much, man. How you doing? Thanks for having me.
I'm doing great. I didn't even ask. I've known you for a while now, but I didn't even ask what your actual title is at HealthJoy.
Let's see. What is it now? It's Executive Vice President of Partnerships.
Okay, cool.
Which is, I think, just a glorified title that says you're a salesperson.
Fancy sales guy.
Need you to be across the country and do what you can do to open up more distribution channels through consultants, TPAs, and wherever we can provide value.
That's awesome, man.
Yeah.
I love it, though, too. Sometimes I have to explain my title because I sort of helped when the role at Pareto was created. They're like, well, what should this role be? What should the title be? And we came up with the idea of consultant development. But what I found out, there is no context for that job at all. So all I have to do every time if somebody asks, I have to explain it for like 5 minutes what I do.
Yep.
And I'm in sales-ish, like I'm a force multiplier, whatever you want to call it.
Yeah. And the one thing I love about it is, the title is a title to me. I don't care about the title. I want everybody at my company, whether they're a new person, a tenured person, we're on the same playing field, right? Yep. I think that's what I loved about our culture is it's one team. It's as cheesy as that sounds. It is. We're one family, one team. We're all salespeople. We're all here to help each other win and provide whatever value to help establish, long, mutually rewarding business relationships with our partners out there.
Yeah, and that's, I don't know if we'll use where we were chatting earlier about the, actually truly building relationships. I'm sure that'll be part of the conversation, but it's like relationships have to be coupled with delivering actual value 100%. To your customers, solving problems. I can't speak right now. But let's go back, Dave, in your background, man, because I think you have a pretty interesting story. Most people do have an interesting story, how they found themselves in healthcare, but you especially so. I think it's a pretty good one. But I want to hear a little bit about you, too, like growing up, and I know you're a baseball player, so we'll weave that in there as well. But just give us your bio, man.
Oh, man, I'll try to keep this short. But, I grew up in Northern California. That's where I grew up my whole life. I live in the suburbs of Chicago now, but my whole entire adult life has been in the Chicago suburbs. Went to Santa Clara University. I think this is, I had a full scholarship for baseball. And it's funny, my parents, when I was a freshman in college, moved away to Chicago. And usually it's the other way around, the kids move away. But I ended up, playing there, doing well, ended up getting hurt, and ended up moving back after graduation, sitting, kind of doing my thing, doing some rehab, trying to figure out what pathway I wanted to take. And you know how parents get to like, if this kid's going to live under this roof, you better start getting real and getting a job. And got into business just on the enterprise rent-a-car front, which we were joking about. The management training program, which honestly, I think we all laugh about it. We've seen the movies that highlight what a great management training program. But I will say it built really a great foundation of customer service, the customer empathy, sympathy, things like that. And that's something that I've always taken a lot of pride in as I've translated that into other organizations that I've joined. And
well, you see, you kind of tongue-in-cheek make fun of the enterprise management and training program, but things become a cliche because they're effective, right? Usually because they're true, and you can joke about it as a cliche. But we wouldn't be joking about it because we wouldn't know about it if it didn't work, right? And a lot of people I've known have gone through that. I actually think I was close when I had, I didn't have any real transferable skills after college, and I was looking for a job. I'm pretty sure I interviewed with Enterprise, but didn't end up getting the job. But so I want to ask a couple pieces of that story. Baseball, I mean, I think I can think of Sean Sanford, Omar Arif, Taylor Rogers, lots of guys that have played ball at a really high level. You were a pitcher, right?
I was a pitcher.
Yeah, okay. But you were a righty.
Unfortunately, I was the righty.
That's what Taylor says. He was a lefty. He said, I think he said lefties are like blondes. They always get a second look, even if they don't deserve it. That's what he said. Sure. So a little bit high as a righty, you had to have a little bit more oomph, but you were hitting like 96, 97, I think you
topping out 97, consistently 92, 93. And, college, it was a great experience, but it was...
There's a back injury that derailed you.
The back injury hurt, had sciatic nerve damage, which was, it was hard to go through that because you saw this vision in every kid growing up wanted to be a pro athlete and following their dreams. And I do believe that there was a pathway for that to happen, but obviously something said, that's not your path. And I was very fortunate to have a family that was very supportive and really just said, hey, it's time to grow up now and let's think about your future and what you want to do. Yeah. So again, kind of got me into just like getting into the business world on enterprise.
Well, let me ask you this, because I was probably similar to you that I played soccer almost till like, I think 23 in college. Yep. And it was essentially my identity for the majority of my youth up until early 20s. Then you get out of college and you're like, who am I? Yeah. Like, did you find it hard to transition away from the identity of baseball?
100%. I mean, the first, honestly, I'd be lying if I said otherwise, years, right? Because you see a lot of these players that you played with. Yeah. A lot of players that you knew you probably had more athletic ability than them, but somehow just over time just worked hard, got to it, right time, right place. It ended up making it to the bigs. And you know what? They got there for the right reasons and were successful. And a lot of players we played with. I mean, I played against Mark Pryor, for the Cubs. I played against Xavier Nady, Lyle Overbay, a lot of these big time players. So you always kind of think back like, man, that would have been really cool. Yeah. But it's also all of my relationships in college are my best friends are my college baseball buddies. We all get together every year. So even we all get together, all the players we played against, it's this big one giant family that we still share those memories.
Yeah, but you share a bond around the thing, 100%. Right? That's never going to go away. But like, I was kind of curious because I found myself going like, what do I do now? I was always associated with the sport and everybody knew me as that guy. Now I have to sort of reinvent myself. Oh, and I get thrust out into the real world and have to make money and pay rent and things like that. It wasn't something that I shied away from, but it was it was a strange thing to transition to.
I mean, my just to give you an idea, my major was anthropology. Okay. So people say like, what the heck were you going to do with anthropology? And I'm like, you know what? It was really the only class I ever took in college that I really paid attention to, that I enjoyed going to, just learning cultural anthropology, physical anthropology, forensics. And it was like, what was that going to translate to in my career? And as you said, like, I didn't know what I wanted to do. I was still this young 22-year-old kid that was still having fun, having a great time. And now I was in a new area in Chicago, just trying to get to know, I knew nobody, right? Yeah. Like my family, everybody I knew was in California. I had to start fresh, which I think was really the foundation of my family saying, this is what you need to do. It kind of broke me out of my, believe it or not, I was very introverted, shy, reserved. I remember
you telling me that, and I can't picture that now.
And it made me get out of that shell. Okay. And I liked it, but then kind of getting into healthcare, fast forward, I did enterprise. And then I was trying to figure out, like, what do I want to get into? I was into fitness. I liked health. We're all into kind of that, being an athlete. You're just naturally into fitness. But I had no clue what pathway I wanted to do. And it was in 2009 that my dad's company had invested in a wellness program when 2009, when wellness was the new big buzzword in our healthcare space, that did biometric screenings, on-site blood draws, full panel blood work to understand what your numbers were, health coaching access, reporting. It was just this opportunity to talk about know your numbers and let's prevent things from happening. Okay. At that time, I didn't know the strategy of what wellness was. I just knew that my mom went through this program. And fast forward, the chief medical director had contacted my mother and basically said, hey, Beth, have you seen your results? And they actually found aggressive growing cancer in my mom after further testing. So I look back and say, I will never be the person that's going to sell you on ROI of wellness, but you do need to know your numbers. And I could say if it wasn't for that event, I don't know if my mother would be alive today. Okay. And that was the light bulb that went off in my head and said, I want to do that. So I ended up reaching out to the company, interviewed, got the job. I was there for about 6.5 years, loved what I did. Very obviously having a personal story, this healthcare is very regionalized and very personalized, and having a personal story that just drives me every single day, I think is what allowed me to be successful. And the company that I worked for, open door policy, the CEO you can talk to, it was a very family oriented with a big direction to help change healthcare. But one of my most frustrating things, and I share this even in presentations, was no matter what I was doing, how great I was doing, how well the program is working, we're going into these renewal meetings with my TPA partner and or a broker partner, talking about the results that are great. But then the next conversation is, oh, by the way, your healthcare costs are going up 25%. Right. And they're looking at me like, well, what the hell did we just invest this program? It's not doing what we asked it to, even though it was. And that was always frustrating for me. So I ended up leaving on great terms because I wanted to just see what else was out there to really get into the weeds of where the issues, and pardon my French, just the craziness of healthcare. Why is it so messed up? And I ended up working for a health plan that really incorporated telemedicine, virtual services, concierge-like services. And I really liked this model
Okay.
And it was really this hand-holding white glove service to just be an advocate for members, help them understand their benefits, and really guide them through their healthcare journey, which I saw the opportunity of. That's how you start changing behavior. That's how you start driving outcomes.
Okay.
The one thing it didn't have was technology. So fast forward to 2017, parted ways, and I'm sitting there thinking like, what the heck do I want to do? And we talked about this. I knew I wanted to stay in healthcare, and I knew I wanted to get into technology, and I literally just Googled healthcare and technology, and I was like mind blown about all the money being invested in all these startups and just great different pathways, wellness, virtual medicine, medical device, whatever. I was like, God, this is an opportunity that I could try to become something and be a part of something big. And that's what drove me from my competitive side.
Yeah.
Long story short, interviewed with a bunch of companies, was about to take an offer, and then out of the blue, I just saw this posting from Built in Chicago, which is a job posting thing, and it was from HealthJoy. And I remember looking at it and going like, am I just reading my resume? And I'm like, holy cow. And I reached out to the CEO, Justin. He got me introduced to Doug, who's their two co-founders. Next day I met Doug, and I literally, they probably saw me drooling because I'm like, I want this company.
Yeah.
What they were doing, and I know we'll talk more about it, I just saw an opportunity of like, man, I want to do this. And they had just received their Series A funding.
Okay.
They had just pivoted the company from where it started to where they are now and what we're continuing to do as an organization. And I wanted to be a part of it. And I ended up, fortunately, they took a chance on me, and I became the first salesperson that started and really helped them build out the strategy of how do we go to market, what are we doing, what's our value prop, and really built the foundation of our strategy and our messaging to be where we are today. And just to give you context, I think we had seven groups back in 2017 when they had pivoted. We have over 2,000 today, service over 1 million members, and built the team to 30, 40 sales reps, massive marketing team. We have over 450 employees. So it's been an incredible fun ride and journey to just see this opportunity.
Well, yeah, you kudos for you. I was just going to say, commenting from the outside looking in, recognizing what it was, like what it was capable of, even at the time, like you said, there were 7 customers or whatever on the platform at the time to get to where it's now. Not everybody has the ability to like recognize what the possibility of something. And then I would say be so proactive as you were to say, I want to be attached to that. I want to sell that, right?
Pareto Health is the largest benefits captive in the United States. With nearly 3,000 captive members, 1.3 billion of stop-loss premium in force, and almost 1 million covered lives, no other benefits captive comes close to Pareto Health's scale. But it's not just about the numbers. Pareto Health is a mission-driven organization, and that mission has 2 distinct parts. Number 1, to make self-insurance simple and more accessible for small to mid-sized employers. And number 2, to arm them with the most powerful cost management tools on the market. So if you're an employer frustrated with your healthcare outcomes, or you're a benefits consultant looking for an alternative to the status quo, it's time to consider Pareto Health. Pareto Health, where employers come to do self-insurance right, to do it easily, and to do it at scale.
What actually, I want to take a step back before I'm going to ask you so many questions about HealthJoy. I want to ask you, one, why was wellness booming at the time, that at 2008, 2009 period? And then I want to ask you, what failed in that first generation of wellness? So like, give me some context. Was it Obama coming in office? Was it after the crash? Like what was about wellness being so popular?
Honestly, I don't know why wellness became a new thing, because I'd never been in the healthcare space, right? So I just know that this was a company that was founded in 1992. They were offering biometric screening. So he saw an opportunity of bringing the convenience of a doctor's office on site to an employer group to do blood draws, because we know not many people are doing their annual physicals. Okay. So it was really the opportunity of convenience on site, but then having access to health coaching tools and resources to help that member understand, what do your numbers mean? Are there flags? What can you do proactively to live a healthier lifestyle to prevent chronic conditions developing over time, right? And that's why I go back to, I'm never going to be a person that sells you on ROI, but I will say you need to know your numbers to prevent things and progressing in a timely fashion, because that's where they become more costly. So we boomed, and they were just hiring like crazy. It was a company that was founded on ADP executives. Okay. A lot of ex-ADP employees, as we talked about the ADP mindset of salespeople, they were go-getters, they were hungry. And I think they just wanted to bring in some new, younger talent, I guess, people that were just younger and hungry that just wanted to go out and sell and win. So they hired 6. They called us the A team, the young guns. I was the oldest. I think at the time I was like 28, maybe, which now my age is getting out there. But it was fun because we came in and you could see even in the first week, we went through this rigorous training. We had to know the ins and outs of, what is cardiovascular disease? What is diabetes? What is the impact, the cost? What does that mean to a business? And we were the ones teaching and coaching the tenured reps there.
Okay.
And you could just see them go like, holy crap. These guys they got it. And it kind of lit a fire under the whole sales organization, which made our company just skyrocket, which was pretty fun. And it was backed by private equity, 2 different buyings. And what happened at that point, it was unfortunate. I saw the writing on the wall. There was change in management. And I just saw, I wanted something new to kind of take my skill set and learn more about other areas within the healthcare space. And fortunately I did, because what happened, I started in 2017. COVID eventually hit. The company was doing okay. They didn't really invest too much in technology, and it was really primarily focused on just the on-site biometric screening. So you can imagine when COVID hit, that all shut down.
Yeah, all shut down. Yeah.
Right? And unfortunately, that company had to dissolve.
Well, and you say, I think I'm in agreement with you that it's really hard to pinpoint or quantify ROI from a wellness program. I think there's a general belief that if you get people these screenings or change their behavior, that it should deliver financial ROI over time. I just think the struggle is connecting those 2 dots. Like there's a theoretical or conceptual belief that will deliver value. And then there's a disconnect of provability of that. And so I think it created an inherent skepticism around wellness altogether. And then you add in the element of like employee churn, where you might keep an employee 2 or 3 years, and then they leave somewhere else, and then you created a change in their behavior that improved their life, but yet they're working for somebody else, right? So like you paid for them to get healthier for them to leave. So like there's just a lot of dynamics, and I'm just curious what were you in your mind if you were to create a wellness company today? Like, do you have any idea what it would do differently?
Oh my God, I have no idea, but I know I would invest in tech. I know that.
Tech, okay.
I mean, let's be real. We technology's everywhere. It's running our lives. We have smartphones in front of us. We can't leave home without it, right? And I think if you invest in products that can truly engage a member, keep their attention, and create an experience, which we talked about, right? I think to me, and one of the biggest things about HealthJoy is we're always focused on the member experience. And I think if I was going to start something, it was always going to be about technology, but an experience that got me to want to use it, but then want to use it more. And making it simple and intuitive. And we talked about, thinking about these other apps that we use every single day. Amazon, Uber, Netflix, Grubhub. It's like, we don't even think twice. We have an app for something, and we just click a button, and you're brought into this experience and then navigated very seamlessly, streamlined to get to the end result of what you were hoping to get. And you're not even thinking about it. It's become second nature.
Well, you use the analogy, and I really liked it when the Google Maps analogy, right? Like we'll press open Google Maps, you put in an address, and it's going to give you 3 or 4 options of which ways to navigate based on shortest distance or the amount of time, avoiding a toll roads here in Texas, which is a big deal. But ultimately, once you do that and you click the button, it says go. It takes you the whole time. It'll reroute you or recalculate if an accident happens. I use Waze especially, so Waze is adding real-time traffic. But the point being is they've almost can keep us ignorant to everything that's going on behind the scenes, and we trust it to get us to where we want it to go, and then we don't worry about the how so much. It's taking care of the how.
Just get me there.
Just get me there, right? And I think that's what you were saying correlates to what HealthJoy does. And so before I follow up to that, why don't we at least describe HealthJoy? Because in case somebody's never heard of you guys before, let's just position what you guys are, what you do.
Yeah, it's like, Dave, do your elevator pitch. And I wish I could make it a very simple elevator pitch, but the reality is HealthJoy is so comprehensive, which I love, and we'll get into the weeds of that. But I think the simple thing, if you want to bucket us or categorize us, it would be care navigation, which ask any person, there are 20 different people, care navigation, you might get 20 different answers, just like wellness. I think the easy way to look at us is we've created a digital platform backed by live human concierge that essentially is built to overlay on top of your entire benefit plan structure, all your point solutions, cost containment strategies, and we make it work. We are the technology platform that makes all of those strategies come to life and truly drive members to get into those programs so that they can do what they do best, with the intent of lowering healthcare costs. How do we increased benefit utilization, which we know is a big pain point and challenge. We've invested in a lot of these great programs. How do we get people to actually know they have it and use it, right? Third, we know that HR is strapped thin. I mean, especially with Pareto, you're focused on this mid-market space. I mean, I've heard that, that an employer group of 500, they might have a team of HR of one person. Thinking about what they do every single day and the time they invest, they need help. So how can we act as an extension of their HR team to help support their strategies and help promote and communicate these programs throughout the year so they don't have to do that? And then ultimately, how do we create this experience that drives down cost? And that's literally what we're trying to do, to simplify it through technology.
Well, and that's what I was using the corollary before, and I think before we set the cameras up, of everybody unbundled cable, right? When it was great, let's separate ourselves from all these channels we don't want, and all the commercials and blah, blah, blah. And then we had this long period of time where there was individual apps that were out there, the Netflixes and the Amazons and the Apples. Now what I'm seeing happen, especially with Prime, is the reintegration of, now you go into Prime, oh, and HBO Max is there. Paramount Plus is there. Live Sports is there. All of a sudden, Prime is like rebundling everything back together, because I think people got app fatigue, or they got unbundling streaming fatigue, and they just go, give me something that's got it all back in one spot, just 100%. Like my old cable box used to have. I think healthcare, and especially self-funding, is doing that same thing. Like, I can unbundle everything. This is amazing. I can get all these awesome vendors, and they're all going to do really cool things. But if I have 12 or 15 or 20 of them, and my members have no idea what one is versus the other, and they don't use them properly, they're useless. They're literally useless at that point. So you rebundle everything with a HealthJoy so that it's all in one place and they can navigate through.
That's why our consultant partners, and I'm not going to say think I know they love us, is because, especially the most innovative and who we want to work with, right? We made it very intentional that we don't want to work with everybody in the industry. We truly want to partner, align, and strategically focus on who are the most innovative, forward-thinking consultants that want to take that approach of, I am tired of how this healthcare systems be. I want to unbundle all of this garbage and take my best-in-class strategies, bundle that together. That is my cost containment strategy as a consultant or a captive. I need something now that's going to make this all communicate. And that's what HealthJoy does. We are truly that mechanism that sits on top, that aggregates all of those, but more importantly, integrates with all those point solutions, so that when a member comes, they have one place to go, and that's HealthJoy. Because to your point, open enrollment meetings, how do those go? Everyone's like, great. Is my doctor still in network? How much more do I have to pay this year? And they don't want to hear that I have 15 other apps that I need to go to. They're not going to remember anything after they leave that meeting. They want one place to go. So if we can flip the switch, and why HR loves us is because now they can go to these open enrollment meetings and say, we've done all these great things. We've changed networks. We've done this, but great news. You don't have to worry about it. All you have to do is just go to your HealthJoy app, because they've taken everything that we've built, we've brought in, we've enhanced, we've added. They're all benefits to help you save time, money, and frustration. HealthJoy will be the air traffic control to get you pointed and connected to the appropriate benefit at the appropriate time for the lowest cost and highest quality. I almost said lowest value.
lowest value. Lowest value crap. But
that's it. And that's honestly what members want. And I know brokers today, they're point solution fatigue is a real thing. Right?
It is. I mean, well, I think most consultants don't want to have to try to be an expert in everything. And I can sure as hell tell you that most members that are just trying to consume healthcare somewhat intelligently don't want to know everything as well. They simply want, like you said, to press a button and now be walked through, what do I do next, right? If I've got to go get a procedure, an MRI, or if I need a surgery, what do I do? Or can somebody call me and even tell me what to do, rather than have to go navigate this minefield myself?
I'm feeling sick. Where do I go? What do I do? Do I know I have this telemedicine? And that's the beautiful thing about HealthJoy and the technology, is we're bringing all these strategies front and center. Whatever you say and you come to us through that one click of a button, it's basically saying, what do you want, what do you need, and what is important to you? Because as we talked about, healthcare is very regionalized and it's very personalized. It's not just about, let me find you an in-network provider. What's important to you? I want a female doctor that has 25 years experience affiliated with this hospital system. I don't want to drive more than 10 minutes from my home address, and I want to make sure that they're Spanish speaking, and I don't want to pay for on-site parking. That's a lot to take into account. Do you think just go to a website is going to show that? No. So even though technology allows us to streamline that conversation to say, meet them where they're at, very quickly, intentionally, to say, tell us what you want, what you need, what's important, go on with your day. Members want that. Just set is like that infomercial, the set it and forget it, right? go on with your life. That is now passed off to our concierge and live human that's now doing all this research, because we have built out the technology in the back end to understand the benefits, the contracts, the networks. Do you have on-site clinics, near-site clinics, wellness programs? You have an MSK program. All of these different cost containment strategies we're talking about, we have all that right here. And now we're saying, okay, based on what that member said, based on all the cost, all the quality, let's find the best recommendation for that member. And now let's serve that up on a silver platter and say, hey, member, great news. Let's walk through the recommendation, and it's going to provide all the details of what cost, availability, verified, and then say, what would you like to do? And now members are like, holy cow, this is the first time ever I've been literally given a recommendation that's going to save me frustration, time, and a ton of money. And all I have to do is say yes, and they're going to hold my hand every step of the way there through the healthcare journey.
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. But what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
And I think that's with I want to say a misguided premise of folks that are very AI concentrated. I think AI, and I've talked about this a number of times, I mean, it's here. It's not a forward-looking thing. AI is being used and has been used for years in healthcare, and it's very good at tasks. What I think the false premise is that it will replace everything. I think I'm of the nature that I would still, even if everything was spit out in front of me, I'd still want a human to tell me, like, are you sure? Is this right? Yeah. Like, are you sure that's what it's going to cost? Is this, should I go here? Yep. Can I ask a question of why this was recommended by somebody that has some research that they've done to give me some context or a second opinion? I think still having the availability of a human being is very natural of a desire, at least for me. And I imagine a lot of people probably feel the same
100%. Way. I mean, we talk about our DNA is technology, and HealthJoy, that's one of the things that I loved is our DNA is truly technology. And another reason, not to give them kudos, but Doug and Justin, my two co-founders, and why I wanted to come to this company to begin with is here was two entrepreneurs that have built and sold technology companies, young entrepreneurs that have built it very successfully. They had an opportunity to get into the healthcare space where they saw an opportunity through just the challenges and everything we talked about, what's broken in our healthcare system. And they just said, there's a problem and we could fix that with technology. And I liked it because they weren't brainwashed by our healthcare system. Yeah. They came in with this, just, there's an opportunity, we could fix it. And they wanted to simplify that. And that's how HealthJoy was founded. And it is driven by AI, meaning chatbot technology. We have the ChatGPT, which is making it more automated, more scalable, more instantaneous on other information. However, we're not removing that human element. And it's to your point, there's companies that are strictly tech. There are companies that are strictly white glove, handhold, concierge, one-on-one phone conversations. You need both. And that's what HealthJoy does. We have over 230 live human concierges that are doing all the back-end research to verify everything. But to your point, it's also, there's members that would like to talk to a live human being, and AI can't do a lot of that.
Yeah, absolutely. Well, so what was the original, since you know the founders well, and you were obviously joined when it was really early stage, what was the original problem that was being solved at that time?
Yeah, so the company was founded in 10 years ago, 11 years ago. I can't even get my numbers, 2014. Right? Is that the math? Yeah, 2014. And basically, Doug and Justin had built and sold a very successful technology company, and they were trying to figure out what's the next opportunity that they wanted to get into. And I know Justin was on health insurance. He had just bought an ACA plan, and he's an MIT engineer, and obviously a very brilliant individual. And he had hurt his knee. I think it was his knee that he hurt, and he tried to access care. Here's a smart individual that went online to try to figure out how to use his benefits that he had just purchased from an agent and his plan. And he had no idea what he was doing. It didn't make sense, didn't know what things cost. And he was just like, what is this? And fortunately, he actually knew the two co-founders of a very large private exchange and basically said, what the heck's going on? And that was the epiphany of basically like, we are blowing up with the potential of ACA having 100 million members on it. We need something to help address all these individuals that are buying a health plan that have never had health insurance. They don't know what they're buying. They need help.
Okay.
What can you and they said we could build a tech to really support the member experience to help them understand what it is. So that was literally the idea on a paper napkin to say, let's build a tech that's powered by tech AI, have some concierge support, but literally bring in virtual services like telemedicine, RX reviews, to take the plan that member just bought, put it in one simple, intuitive app, and then that is the place that member goes. So the conversation of an employee just entering the ACA, buying a plan, now has the option to purchase HealthJoy. They did, and it really just streamlined that connection right there.
When did you guys pivot over to the group space? Because I think that's obviously was a change from the original business model. Yeah.
And I know they're looking back like, thank God they made that decision.
Yeah.
I think it
was.
was
they pushed that direction
2016. I think it was 2016. If you think about the model, it was, ACA didn't pan out to have the 100 million members on it that they were anticipating the opportunity there. But I think also, too, you got to think about the business model of people that weren't making that much money, that there was a lot of declined credit cards. So it was a very disruptive thing to manage that. And I think it was more of a headache. And they decided to pivot to really focus on the employer space because they realized there was nothing really doing what we were doing in that employer market. But what I love about the beginning of the HealthJoy story, and I say it today, and it really has built who we are and what makes us different. We had about 70,000 individual employees on HealthJoy prior to me being here on the individual side. It managed over 22,000 variations of health plans. That is a very flexible technology you have to build to be able to support those different changes and different benefit plan structures. I say that because when it was carried over to the employer space and you're talking to a broker that says, well, I have a group that has 3 different health plans and 2 different dental products. It's like, we could do that. We can support it. So at that time, they were going onesie, twosie, working with brokers that might have 5 or 10 clients. They just wanted to get traction in that space. And I think they quickly realized that, man, the healthcare is it's a big industry. We were talking about the big industry, but man, it's very, very close. Everybody knows each other. Yeah. It's very relationship driven. And that's when I think they realized they needed somebody that had experience working with brokers, health plans, and TPAs. And that was when in 2017, when I talked about my story, I saw that job posting and I'm like, I want to do that.
Yeah. What was the early days of getting out there and selling it? Was the market pretty receptive to what you guys are doing?
Yeah, it was. You know why? Why? Because I had relationships existing. Okay. I was able to get those meetings immediately to go in. And, it was funny when we talk about our simple goal at that time was healthcare is very confusing, it's very complex, and it's very fragmented. Mm-hmm. Imagine if we could remove that complexity and that fragmented experience by bringing those different strategies into one solution. Will that solve a lot of the issues, Mr. and Mrs. Broker? Absolutely. So that was really what we were going to market with, was selling this centralized access to all your benefits. Yeah. And then really pushing in a fully integrated virtual telemedicine, because we knew having an ecosystem that had virtual care was going to be a big thing, which we obviously all experienced pretty quickly and easily during COVID. Sure. When virtual care became a booming thing, we were already really delivering that to our consumers.
Yeah. Well, and was there context to be drawn with other players in the space? And I'm not asking you to name names, or were you educating on the marketplace for something that didn't really have, a peer at that time?
Yeah, quite honestly, there were some players. I don't think they were doing everything that we were doing, but I think it was such a new term, care navigation. Yeah. We were on the front end of something big, right? I think we really became, I believe, in my opinion, one of the people that kind of developed the care navigation model. I'm not saying that others haven't done that, but I think when I joined and when they pivoted is when care navigation be it. And there's players that have gone really upmarket, really focused these type of strategies on the enterprise accounts. There's never been anything really scalable and flexible enough using tech to really accommodate that mid-market where we really flourish, call it that 50 to 3,000 space.
Well, that's my favorite space to be in. Obviously, you know what I do at Pareto and where we swim as well. But I think the mid-market space has just been so historically underserved.
100%.
It's really interesting when you get to present the idea of, let's say, a captive to an employer that has 120 lives, and they've never gone self-funded before out of fear of volatility or fear of it's too complex, or that's for the big guys. And then you get an opportunity to present that value proposition to them downstream, where they have all the advantages that they were hoping to get, but they don't have the disadvantages that they perceive they would have if they'd done it on their own. And then you realize all of a sudden, those same CFOs are just as sophisticated as the one running 10,000 life employers, and they just hadn't had the ability to do the thing they were wanting to do for a long period of time. And now you get to bring that to them and say, hey, this is tailor-made for a company like you. Like, it's really cool to be able to do that, to see that marketplace served really, really well. And it does sound like you guys tried to stay in the middle market space as well.
I mean, we have groups that are 15, 20,000 lives.
Okay.
We definitely do service that, but we knew there was to your point, a big miss, a big void, and naturally something in this 50 to 3,000 that there wasn't anybody being able to serve it. Why? Because it was limited to really a white glove hand-holding service where great models, don't get me wrong, but they're really focused on a specific targeted risk population, the high-risk population, the trending at risk, which you need to do. But you do miss out on another 85% of the population that they're not able to really support on a personalized basis. Technology allows you to do that, allows you to be more flexible, scalable. It allows us to engage 100% of the people leveraging technology. And then our live humans, because always interact with the members on a higher, at the higher risk population.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Well, I want to go back to the idea of experience. I mean, we use HealthJoy. You obviously know that. I have HealthJoy on my phone. I've used it a couple times. It's really cool. I want to, though, think about that experience. Like, when you say you're trying to deliver an experience for your average member, what does that look like in your mind?
To me, I mean, I think I've used the term so much. I'm just trying to instill it in everybody, because to us, everything is about the experience. And I'll say that because if you think about every other aspect of our lives, if you have a good experience with something, you use it. The more good experiences you have, you use it more and more. And once you use things more often, again, going back to the Amazon, the Uber, the Netflix, we just have a Google Maps. We don't even think twice. We click it. We have an app for something. It's been instilled in us and created that muscle memory. And that's that experience that we're trying to create in this healthcare system. When people need something in healthcare, we want them naturally just to say, boom, HealthJoy. And that's what we do. And when you have that good experience, to me, you focus on the member being your center of your universe. It's going to impact everything across the entire landscape of that organization in a positive way, right? You have a good experience, what's happening? Members are understanding their benefits. Members are coming to us and we're guiding them to a better, high value, low cost option. Members are saying, wow, that HealthJoy thing just saved me $3,000 on an MRI. I had no idea. I was just going to write the check like I normally do. Right. Or avoid care like most people. We're getting them to use the benefits as they were built and designed to use, and we're getting them to use them the right way. So HR loves it because now their members are coming to us, not HR, and we do understand HR wants to have that parental of their employees. They want to own that, but part of our value prop is imagine HR if 80% of those common questions you receive after open enrollment are now
what's
just
my deductible?
Yeah, how do I lost my ID card. Those very basic things. I'm sure you would love for somebody else to take so you can focus on more business.
I joke around with one of our tech guys, Corey. I'm like, dude, it's like 97% of the calls you get, the answer is just, did you try restarting your computer?
Exactly.
And he's like, yeah, pretty much. That's all.
So remove those common things so you can focus on more business critical things. Imagine how much time we can now save you. So HR is like, this is a godsend. I love this. And then it's also a tool using technology, right? We leverage push notifications. And this is a stat I always share because we don't really think about the power of our phones. I mean, we all have it. We all have it in front of us. And I'm the first to admit, if I get in my car and I'm driving down the road and I realize I don't have my wallet, I'm like, whatever. The moment I realize I don't have my phone, I'm like, oh my God. How do I get back home? Why? I mean, I'm seeing you pay a bill over here on your phone. You're opening up a thing. Everything is on our phones. But the other thing is, why do most of these other point solutions get underutilized? And at the end of the year, we're trying to question, was this worth the investment? They should be, but nobody's using it. And part of the reason is because we're communicating these programs that benefit the value at open enrollment. Maybe we have a wellness fair. Maybe there's some emails sent out to the employees. Maybe there's a poster in a break room to, hey, don't forget this, don't forget that. That's not creating the awareness or the engagement in these programs. But what does capture people's attention? People are very easily, quickly responding to push notifications.
Okay.
It's the most preferred means of communication in our world today. And this stat always blows me away. Last year alone, there were 10 trillion or so text messages sent.
Jeez.
98% are read in less than 2 minutes.
Okay.
Yet less than 20% of emails are opened.
Yep.
And less than 14% of phone calls are picked up without being put on hold or shuffled around a call center. So I always say, continue to leverage the ways to communicate these programs through phone and email. But if you truly want to have an opportunity to engage that member and promote these, you have to use tech. And that's what we do to really drive that, which is also a better experience for members.
Yeah, that's what I remember when I was using it for myself. I would think I was looking for a primary care doctor in the area. And then I went through the search and I even looked up a few, and I forgot if I called or not. But I actually got a follow-up from somebody saying, hey, did you get what you needed, or were you able to get to the person? And I think at the time I was like, yeah, I'm actually good. But they called me to ask the question. And I said, yeah, perfect. Yeah. I'm good. But thank you for the phone call. Just knowing that somebody's there just to maybe I didn't click because I got distracted, or maybe I didn't find what I needed. I wasn't able to qualify the person myself, and I maybe just gave up or moved on to something else. But that closing of the loop was something I really appreciated.
Yeah, and that's what we do. It's what I love about technology is, as you see it today, it's only going to get better.
Yeah.
It's going to get bigger, better, faster, stronger. And a lot of that is our roadmap. It's the demand of the market, but more importantly, it's through our partnerships. We have broker councils, partnership, council advisory boards where it's like, we want to come together and talk about, here's what we're hearing in the market. Here's what we're thinking as a business. Here's what our roadmap is. And it really provides our partners an opportunity to come in and say, great idea, bad idea.
Yeah.
I wouldn't do that. Have you thought about doing it this way? So when I talk about what excites me about HealthJoy is our partners really are a big piece of where HealthJoy is going in the future, because we're adapting, we're evolving, pivoting just as the market demands, and our partners are seeing the future too. It's not just about what we think.
Yeah, in the spirit of talking about the future, I always like to do that on the podcast. But give me some ideas of what maybe the shape of healthcare in the future, what that looks like to you, or what are you guys trying to get out in front of? Because with technology, especially, you cannot stand still. Because if you get stagnant, somebody's immediately going to zoom 100%. Past you. So what are some of the things you guys are solving for right now?
I think the biggest thing that's been really exciting, especially the last 2.5 years. So my role is transition. When you mentioned what my role is, went from kind of opening up the broker distribution, managing a team, and then being asked to open up our new distribution kind of strategy through health plans and TPAs. So even though at our core at HealthJoy, we're agnostic, and I kind of talk about the experience. We wanted to go to market focused on the experience and the technology as it is, bringing in cost, quality, RX reviews, medical bill reviews, all of these things to be one of the most robust, comprehensive benefits guidance platforms in the industry. If you think about the core, it is still a reactive approach to healthcare, meaning you, Spencer, need to know you have HealthJoy, go to HealthJoy, use it, and then we could provide a service and show you value.
Yeah.
You need to be proactive. So what's exciting now for the last 2.5 years is we've started intimately and fully integrating with strategic TPAs and health plans where we're now ingesting the data. So we talk about the future. Right now we're doing it because now we are able to flip a reactive approach to healthcare, leverage data because the power's in the data. Now we know when a member's accessing healthcare. We know when a member has triggered a pre-cert. We know when a member has triggered a medical management service that they just can't get a hold of. We get that information now, and in real time, we could proactively use technology through push and email to say, hey, Spencer, great news. We know that you're doing something. Talk to us about what you're doing because we could probably help. So now we're able to proactively engage and capture that member at the time they're about to make a decision and help them make the first decision, the right decision.
Yeah.
So to me, the biggest thing was how do we take a reactive approach to healthcare, which it's been forever, to now make it proactive. And once you start talking about the experience, if I was reached out proactively through tech in a service that I had that said, hey, don't go there to the hospital where the MRI is going to be $2,800.
Right.
We verified that right across the street, you can get an in-network verified in right now or tomorrow for an MRI that's $400. Would you rather pay $2,800 or $400? We'll coordinate everything on your behalf. What would you like to do?
Or not to mention that, even throw an incentive on top, like with something with a KISS card or Valence now, where it's like, hey, if you also go to that lower cost option, which is the same quality of MRI, could you also get your out-of-pocket waived completely? So not only do you save the plan $2,500, but you cost yourself zero in making that decision as well. So that leads me to a question I wanted to ask you earlier is, have you found employers needing to incentivize members to dig into that further?
Definitely the pathway they want to go.
Okay.
Right? It's
what are the best ways in your mind to do that?
Honestly, we have some TPAs that are actually building it into the plan design with different tiers or different deductible spend. Based on this, here's your $2,500 deductible. If you use HealthJoy, it might be $500. So use that, not this, and they kind of do it on the back end there.
Yeah.
Anytime you can incentivize or reward an employee for doing the right thing, to me, it's just benefiting the employer group.
Yeah.
If I'm an employer group and I have a tool that's in the hands of my employees, instead of my company paying $2,800 and they can go for $400, I'll eat that deductible for that employee because they're saving my plan $2,800.
Yeah, especially if that happens 10, 15, 20 times throughout the year as well. I mean, and people look at those $2,800 charges, and that's not this giant, cancer claim that we deal with in the stop loss world. But 10 of those is $28,000. How many, depending on how many members you have on your plan, that's a big line item. Where if you were actually dropping that by 80 or 90% per instance, that's a significant amount of money to save.
And why it's so, which I love about this strategy is, when you kind of break down the 80-20 rule, the Pareto, it's, you have your medical spend, 20% fixed cost, 80% your variable, like your claims, right? And I always have this graph that shows when I'm sitting down, if you break down that 80%, I always think it's funny when you're having conversations with a consultant or a client, they're always fixed on the fixed number. Like, oh, you're charged, can I save $1 PEPM here? Can I save $2 here? It's like, are you really focused on that? We need to be focused on that 80% pool, which are your claims.
Yeah, absolutely, dude.
And when you break down that 80% of your claims, look at this, anywhere from 90 to 95% of that are planned controllable events, meaning a member has an opportunity to make a decision before they do something. They've just never had a simple, intuitive platform to make that decision easy for them.
Absolutely.
That's what HealthJoy is. So to your point, with technology, our price point is very low to be able to service the mid-market space. It's more flexible, more scalable, where we can engage 100% of the population, not just a targeted risk group. But now we're able to get in front of these decisions proactively. That's how you start shaping behavior. That's how you start driving the better outcomes. And that's what we've been doing, and we continue to do.
Well, not to mention, it's not just HealthJoy, but I think in our wallet, if you will, we've got Cancer Care, we've got Progeny, we've got, KISS Card, we've got SmithRx being embedded, things like that, where you're helping us get engaged with those vendors as well. And so a plan, you might need to bring in a Cancer Care, where it's not necessarily, I don't presume HealthJoy is like getting involved with like steering to a center of excellence or second opinion, but Cancer Care could be right here, right? And then 100%. We'll get you over there and get you where you need to be. And the member doesn't have to know the handoff is being made or anything like that. You're simply navigating them through the app itself.
One of the biggest things that makes us different, and we talked about this earlier, is there's a big difference between integration and aggregation.
Okay.
I mean, care navigation I mentioned is the bucket that you can kind of categorize this in. If you look at 10 like companies, we all look the same, we sound the same, we're all trying to solve the same thing. It's until you really peel back the onion of what's going on. You mentioned the wallet. To me, the wallet is a nice thing to have. It brings your benefits front and center, which is step one to creating the awareness of what you have.
Table stakes, yeah.
But if you just see, I have this Cancer Care, you're probably thinking like, okay, what is it? Maybe not you, but the normal consumer would be like, I don't know what this is. I don't know how to use it. The connectivity and the integration behind the scenes, when a member is in the app and they say, I need this, I need that, we know that Cancer Care is there, Valens, KissX is there, Progeny, all these different services. So based on what that member is telling us they want, they need, we are making sure that, they have this portion available. They need the surgery. Let's get this KissX Valens to promote that product and that program, educate them on it, communicate with it, and then do a warm transfer into those services and let them do what they do best.
Yeah.
And that's the connectivity that we're doing.
Well, this is a big step in the direction of when we think like we cast like a lofty vision of how you solve healthcare. One of the components of it to me is making people more informed in the way that they navigate healthcare in the first place. So care navigation is the bucket you said. It's helping empower them to make better decisions, whether they're making decisions on their own or being guided with those decisions and given great options to choose from. I think that most people just want to be able to be handed over a list of a few options that are intelligently curated so they can pick from them rather than being completely blind trying to navigate healthcare. And then they want to go back to their lives. They don't want to be masters of healthcare. We
don't want them to be.
I don't want them to be. They don't need to be, right? It's taken us this long, and you and I both would probably freely admit there's so much that we don't know. Like it's impossible to know everything.
It is.
And we spend every day doing this, right? So expecting a member to have that level of like awareness just is not going to happen.
And as you guys, the captive, as consultants out there, as you said, continue to unbundle and bundle this best-in-class point solutions focused on these different things. And it's continuing to grow, right? There's more and more great companies coming out that really have this niche to focus on and address something that's impacting claims. You want that a part of your overall strategy, but you also want something, you need something on top to make sure they're all connecting, all talking, we're bridging the gap, to your point, to the member. They don't have to know all the nuances and all the workflows behind the scenes. I just click a button, say, here's what I want, and I'm being hand-delivered the best option for them. And the other thing you said is funny, is like, you talk about like, well, how many options if a member comes in and says, I'm looking for this, I'm looking for that. Do you just give them a list?
Yeah.
Sure, we could, and just say, here's based on cost, based on quality, different options. The reality is, and I'm guilty of it, the amount of times if I have two options in front of me, even to make a decision on what I want to have for dinner tonight, I still have no idea. It's a tough decision. So our goal is, how do we make that less confusing to just say, here's the best one? Based on everything you told us.
Well, that's what, have you heard of, and I actually was in Philadelphia last week running our Pareto Emerging Producers Program, and somebody brought up the idea of the paradox of choice. Have you ever heard this? So the way that I can summarize it is the more choices you're given to choose from, the less likely you are to be satisfied with the outcome. So like you said, even two choices for you might end up leaving you dissatisfied. I just want to know the best thing to choose and almost choose it for me. And let me click the button to say yes or not, right?
And if you have questions about it, then let me know. We can find something else. But at least this is the best one. And to your point as well, it's like, it's either I don't know what to do, or worse yet, we've made that member so nervous of what to do and can't make, they don't do anything at all.
They don't do anything,
Which is even
worse. That's the paralysis by analysis, which is kind of the same thing for sure. Well, Dave, let's zoom out real quick and then we'll get on our way and we'll grab some lunch, man. But thanks again for coming down
this is awesome,
and educating me, honestly, because there's a lot I didn't know about what you guys do. But like as we think about not just in the context of HealthJoy, but the context of healthcare at large, what kind of things are you envisioning happening in the next few years? Changes, maybe some problems we're going to face. Like, what do you think it looks like, good or bad, in the next few years?
I wish I had a crystal ball.
Let's just assume we'd both be billionaires already if we did have this crystal ball.
All I know is that I'm going to I don't mean to do this intentionally to bring Pareto into this, but I've known but
tell us more, Dave.
Yeah, I know. Andrew, when I was on the wellness side, I remember being out in I think it was Nebraska when they were kind of opening up the hospital side, and loved what they were doing. And at that time, I had no idea what a captive was. And when I first came here, I reached out to Andrew, Clayton and Kavanaugh, and just said, hey, here's what I'm doing now. And is it the time that you guys were at the process within the captive begin vetting out care navigation strategies? And I had the opportunity, man, that year it was I think it was 2019. I think I spoke at like 11 of your members meetings. When you have them like every month, I'm like, oh my God, they do a lot of these.
It's too much, guys.
And I remember something really stood out to me that Kavanaugh said, and it was, healthcare, one of the missing link in healthcare has been care navigation. We have all these great strategies, but care navigation truly has been this missing link. And that really resonated with me, and it made me realize that I made the right decision, that this is a space that has been needed. It's not a nice to have anymore. It really is a must have, because no matter what you're doing from a captive, all these different ICM strategies, consultants vetting out different point solutions, you need something that's going to bridge the gap and get them all to talk and work as they were built and designed to work. If you don't have that piece on top to do it, we're beating our heads against the same drum, and we're going to see the same outcomes. So where I see healthcare, all I know is that care navigation is going to be a critical piece. I could see that no matter what pathway networks take, whether it's reference-based pricing, these different point solutions, it's not going to get less exhausting. It's going to get more exhausting and more fragmented.
Yeah.
And you need something to simplify that, not just for the member. You need it for the consultant. You need it for the captive members. You need it for HR. You need it for CFOs.
Yeah.
And I know that if you have care navigation, it's going to be really become, and how we've positioned it, a critical piece to every organization's strategy, because it's going to enable your investments to see the ROI that you've wanted to invest in. So,
well, I think I agree with you in the fact that it's only going to continue to fragment further and further and further.
Yeah.
Like if I showed you my DMs on LinkedIn of how many people want to tell me about their solution, and I appreciate the fact that they want to, it's exhausting.
Yeah.
How much is out there. And I think it just speaks to the complexity and the scale of the problem. So I don't begrudge anybody from trying to lean in headfirst and solve it. But there's just too much. There's just so much out there. There's so much noise right now. And so if we could do just a little bit to turn down the dial on that noise, I think it would be a service to everyone.
To everybody.
Yeah.
Yeah, and we're excited about what the future lies, because I told you this earlier. I'm having my 7-year anniversary this week, actually. Hint, hint, HealthJoy. But I could tell you we're just getting started. And it really is the foundation of our success. We have probably I'm not being biased, the best product and technology out there. And as you see it today, it's only going to get bigger, better, faster, smarter. But it truly is our partnerships that we've aligned with strategically, because we're looking at this, and how I view it and take a lot of pride in, and I share this with you. If my partners are winning, that means I'm winning. And if I could bring more value, more thought leadership, more strategy to help my partners win, I'm there beside them as a critical piece, and I'm looking forward to that. So
this is usually where I ask for closing thoughts, but I think you just delivered them. Because remember I told you I planted the seed in your mind over coffee.
I kind of went that way.
You kind of ingested it and you did it. Man.
And I know the next podcast, I got to come up with the captive Kirk, the different thing. I got to be the other guy. I got to figure out the care navigation name.
There you go.
I can be a part of captive.
Carl, how you gonna be like Carl? Oh, we already have Carl Carrier, so it can't be Carl.
We got to be
Navigation.
somebody.
We'll come up with.
Yeah.
All right, man.
Yeah.
Well, hey, if you want to do a Tom Broker
Thanks so
skit,
much.
you just tell me, man. Let's do it. All right, thanks, Dave.
It's been fun.
I appreciate it.
Thank you.
Bye.